The reason a patient would prefer the same day option, of course, is they don't have to make a second appointment. They don't have to come back. And generally, crown, when you schedule an appointment to get a crown in any dental office, it takes about an hour to go through the process of getting anesthetic, preparing the crown, having the impression taken for the crown, having it temporary made. Takes about an hour. In our practice, where we're not having to take an impression, we're able to scan it. So many times in that hour, sometimes even just an hour and a half, we can do that crown and be done. It's almost gone beyond the patient preferring the option. On the extremely, and I mean extremely rare moments where we might have an issue with the machine or something with the software and we're not able to give the crown to the patient that day, they look at us like, I don't get my crown today? And it's almost like we've spoiled them to the point to where it's like, if they're not getting it, they're like extremely disappointed. I've actually had patients leave the practice and go to other dentists when they move out of state or they move out of town to other practices, and they'll write me back and they'll be like, I feel like I've gone back into the 19th century, having to wait 2 weeks for a crown and having to endure the whole process of impression material, because we use a digital scanner, which doesn't require the impression material and all this, stuff that gets jammed in patients' mouths for doing crowns.